Hello, and thank you for watching this video on 10 things to know about TEZSPIRE, tezepelumab-ekko. My name is Dr. Tina Abraham, a practicing allergist out of Rochester Hills, Michigan, and it is my pleasure to be joined by a few of my peers as we highlight 10 things to know about the clinical profile of TEZSPIRE. Number 1. TEZSPIRE's indication. TEZSPIRE is indicated for the add-on maintenance treatment of adult and pediatric patients aged 12 years and older with severe asthma. TEZSPIRE is not indicated for the relief of acute bronchospasm or status asthmaticus. It is the first and only biologic approved for severe asthma without any phenotypic or biomarker limitations. It's important to know that TEZSPIRE is contraindicated in patients with a known hypersensitivity to tezepelumab-ekko or its excipients. Reactions, example rash, allergic conjunctivitis, can occur after the administration of TEZSPIRE. These generally occur within hours of administration, but can have a delayed onset. Consider the benefits and risks. Stay tuned for additional important safety information. Number 2. TEZSPIRE targets and blocks thymic stromal lymphopoietin, or TSLP, at the top of the inflammatory cascade. By blocking TSLP in this manner, TEZSPIRE reduces the release of downstream mediators. This impacts two hallmarks of asthma: airway inflammation and airway hyperresponsiveness. The mechanism of action and the clinical significance of this outcome and its impact on asthma have not been established. TEZSPIRE helps reduce biomarkers associated with airway inflammation. In the Navigator trial, which was conducted over a 52-week duration, the impact of TEZSPIRE on key inflammatory biomarkers was evaluated in a broad all-comer population of patients with severe asthma. The phrase broad all-comer population is important to note, as patients within the Navigator study were enrolled regardless of their biomarker status at baseline. A reduction in blood eosinophils and exhaled nitric oxide was observed as early as week 2 that was sustained throughout the duration of the study. In addition, TEZSPIRE resulted in a slow but progressive reduction in serum total IgE concentration throughout the same time frame as well. These results are descriptive only. TEZSPIRE has also been shown to impact tissue eosinophils. In the Cascade study, approximately 100 patients with moderate to severe asthma underwent bronchoscopy and biopsy after receiving either TEZSPIRE or placebo for up to 52 weeks. Treatment with TEZSPIRE showed an 89% reduction in airway submucosal eosinophils versus a 25% reduction in placebo-treated patients. These results are descriptive only. The assessment of airway hyperresponsiveness, or AHR, was also an exploratory outcome in the Cascade study. The figure shows the change in cumulative dose of inhaled mannitol required to result in a 15% reduction in FEV1, otherwise known as the PD15. Airway hyperresponsiveness, as measured by response to mannitol, was reduced in patients treated with TEZSPIRE versus placebo, with the end of treatment mean change from baseline being 197.4 milligrams with TEZSPIRE versus 58.6 milligrams with placebo, indicating a reduction in AHR with TEZSPIRE. The data from this study show that TEZSPIRE had an impact on two hallmarks of asthma: airway inflammation and airway hyperresponsiveness. As a reminder, these results are descriptive only. Blocking TSLP with TEZSPIRE reduces a broad spectrum of biomarkers and cytokines associated with inflammation. TEZSPIRE demonstrated reductions in blood eosinophils, FeNO, and total serum IgE. Treatment with TEZSPIRE was also shown to reduce airway eosinophils. Number 3. The efficacy and safety of TEZSPIRE were evaluated in 2 pivotal trials in an all-comer patient population of greater than 1,600 individuals, reflective of the patients you likely see in your clinical practice. These clinical trials enrolled patients regardless of their phenotypic profile and biomarker level, as shown here. To participate in the TEZSPIRE clinical program, patients had to be 18 years and older for the Pathway study or 12 years and older for Navigator, have uncontrolled asthma despite treatment with medium or high-dose inhaled corticosteroids and at least one additional controller medication, and had to experience 2 or more exacerbations requiring oral or injectable corticosteroids or resulting in hospitalization in the prior year. The primary endpoint of the studies was the annualized asthma exacerbation rate over 52 weeks. Number 4. TEZSPIRE reduced asthma exacerbations by 71% versus placebo in a broad all-comer patient population in the Pathway study, and 56% reduction in asthma exacerbations versus placebo in the Navigator study. Number 5.
TEZSPIRE reduced asthma exacerbations regardless of a patient's blood eosinophil count, FeNO level, or allergic status.
Number 6. For example, in a pooled analysis of Pathway and Navigator data, patients with blood eosinophil counts less than 300 cells per microliter, TEZSPIRE reduced exacerbations by 48% versus placebo, and in patients with both allergic and eosinophilic phenotypes, a 71% reduction in exacerbations versus placebo was observed. These results were descriptive only. Number 7. A 79% reduction in exacerbations requiring ED visits, urgent care visits, or hospitalizations was observed. Results are descriptive only. Number 8.
Patients treated with TEZSPIRE experienced a rapid and statistically significant improvement in lung function. Improvement in lung function was seen as early as 2 weeks and was sustained through 52 weeks.
As a reminder, the difference versus placebo at the end of the trial was clinically meaningful and statistically significant. Number 9.
Adverse reactions that occurred with TEZSPIRE at an incidence greater than or equal to 3% and were more common in TEZSPIRE-treated patients versus placebo-treated patients included pharyngitis, arthralgia, and back pain.
Number 10.
TEZSPIRE is applied as a one fixed dose strength every 4 weeks. There is no loading dose, no weight-based dosing, and no dosing adjustments based on biomarker levels.
It is important to know that TEZSPIRE should not be used to treat acute asthma symptoms, acute exacerbations, acute bronchospasm, or status asthmaticus. Do not abruptly discontinue corticosteroids. Dose reductions, if appropriate, should be gradual and may be associated with withdrawal symptoms and/or unmask previously controlled conditions. Treat patients with pre-existing Helminth infections before starting TEZSPIRE. If patients become infected while receiving TEZSPIRE and do not respond to anti-Helminth treatment, discontinue TEZSPIRE until the infection resolves. Avoid use of live attenuated vaccines. Most common adverse reactions include pharyngitis, arthralgia, and back pain. So, we have just covered 10 things to know about TEZSPIRE, the first and only biologic approved for severe asthma without phenotypic or biomarker limitations. I hope this information is helpful to you when thinking about a treatment plan for your next patient with severe asthma. The full prescribing information, including patient information, is available at tezspirehcp.com, or you can call 1-800-236-9933. Visit tezspirehcp.com to learn more today.